Hello everyone, today I would like to present about sensory compensation techniques. So we move to the description of sensory compensation techniques. The sensory compensation techniques is used as a treatment for the patient with diminished or absent protective sensation to avoid injury. Diminished or lost protective sensation refers to the inability to feel pain in response to stimuli that are potentially damaging. The treatment consists of teaching the patient and the caregiver precautions necessary to prevent injury to any body part with compromised protective sensation. Purpose of sensory compensation techniques. The first purpose is to maximize or optimize skills while learning new ways of doing things to minimize the problems. Next, to minimize risk of tissue damage and also to restore sensation on affected hand and educate safety education for client. Next, to prevent injury on affected area, and lastly, to increase awareness of deficit. Next, we move to the procedure of sensory compensation techniques. The first procedure is explain to the client or carer the purpose of this intervention. Secondly, educate client or carer precaution to prevent injury to body part with a compromised sensation based on Brand 1979. So, the first precaution is to avoid exposure of the affected hand to heat, cool, and sharp objects. For example, increase awareness of potential source of extreme temperature. Use an unaffected hand to check the temperature. Use unaffected hand to handle sharp objects and to perform household management tasks such as cooking, eating, and ironing. Then, get aid from the caregiver or use protective equipment such as insulated mug, oven mitt, wooden or plastic handle, which is non-metal. Next, adapt task object or use build-up handle on the affected side to distribute pressure. Avoid small handle and change position frequently to prevent too much pressure on the affected area, and use other sense like vision or hearing to observe or check condition. Then, observe the skin for signs of stress such as redness, edema, warmth from excessive force or repetitive pressure, and rest the hand if these signs occur. Avoid using a tight splint strap to prevent injury, and also when gripping an object, don't apply more force than is necessary. Lastly, for skincare, if blister, laceration or other wounds occur, treat them with utmost care to avoid further injury to the skin and possible infection. Then, applying lotion or oil daily enhances skin hydration. Well-hydrated skin less prone to the injury. The picture and the video shows the example of oil and lotion that can be used for the skin. Next, evidence of sensory compensation techniques. Based on Latham and Radomski in 2014, state that occupational therapists should provide treatment or education in compensatory strategies for patients with lost or diminished sensation, but a study shows no scientific finding that support the effectiveness of teaching patients how to avoid injury. Next, conclusion. In conclusion, even though there is no evidence or research finding regarding sensory compensation techniques, but it gets widespread acceptance and further evidence of reliance on their assumed effective to use as a treatment for diminished protective sensation to prevent injury in occupational therapy intervention. That's all from me. Thank you.